We are 3 billion people less in the United States than India and China. And we consume 2/3 of the manufactured pharmaceuticals. Are we really that sick? Hey everyone, it's Dr. Shayna Keller. I'm a naturopathic doctor practicing in Montrose, Colorado. And today I wanted to talk about my dream for healthcare and a brief history on modern medicine. So I'm trying to have this little speaker in my visual. The sound is much better. I denied it for a while. So here we are for my very own video shenanigans. The speaker is in the frame. So let's preface this. I am not a history person, or so I thought. Much like the average American, I sat through like civics and American history and world history, where we learned a little bit about this, that, and the other thing, and memorized these dates, and no one really cares about all these people. They're dead. This is irrelevant. How the heck could World War II, Nazi Germany ever happen again? This was definitely the attitude I have had towards history before I went to naturopathic medical school. Not that I was against history, it's just like the way it's taught in the US is just this state, this state, this state. Like no one freaking cares. Or so I thought. So I get to medical school and we start learning the history of medicine and the suppression of professions like mine and homeopathy and herbalism, which are the people's medicine. They are far more affordable and accessible, and you don't need any fancy degrees to learn about the herbs in your backyard so you can take care of little one's diaper rash or stop the bleeding if you cut yourself when you're in the kitchen or whatever it is. Like the conventional medical system structure has taken away our own ability to care for ourselves, and that sucks. I don't love that, and I'm sure a lot of you also don't love that. We need skills. We need these skills. These skills are important to us to survive. And, you know, the most messed up thing about this is Americans spend more on healthcare than any developed country in the freaking world. And yet, we are number one in maternal mortality. So there's a lady I follow. I do really adore her. She's an MD. She's an integrative doctor, and she poo-poos home births. Well, COVID did not suit well for moms of especially black and brown skin color, which was already awful, than it was for any other group of humans dying. So yes, I will take my home birth with my tub of water, with my midwife, with these people that are considered irregulars. I'll take them because I have a lot more trust and faith in them that they are going to help enact my plan, my goal, whatever that is, to move forward in this world. If I decide to become a mother, right? Like, and I do encourage that conversation with my moms that are considering, you know, do I want a home birth? Do I want a birthing center, which is only for pregnant women, you know, having babies? I don't think having a healthy baby in the hospital, if you can avoid it, is the best place because like the sickest of the sick people are in the hospital, right? And what's the other ridiculous stat? It's like the amount of money that Americans spend. Americans spend more money. We are number 37 in health, and we spend more money than any other developed, civil, quote unquote, country in the world. And we're the number one in healthcare costs. I am not anti-capitalism. Let me just put that out there. I am in business to make profit, and I am in business to help support my community and help people get well and teach them a lifetime of skills that they can ripple effect and teach their children and their grandchildren. Like the buck doesn't stop with you walking into my office and like, here's your pill, here, goodbye. Like, no. And I just want to preface that this might upset people, but this is history. I didn't make this up. The craziest things you can't make up, unfortunately. And, you know, especially those of us that maybe have a different perspective on what has happened the last 3 years. Yay, COVID's ended, woohoo. We were able to see through the veil a little bit. And although good intentions, what's that saying? Good intentions pave the road to hell. So if we are not having the foresight to think, you know, multi-steps ahead, and not just right now in this moment, am I going to feel better today, right now, in 30 minutes after I take this pill? We need to really consider the effects of taking medications and surgery for every tiny little boo-boo scrape, sore throat, blah, 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 without considering the potential negative effects of them. Another aspect that is really important, and I'll just emphasize it here, is an informed consent. I am very passionately against pharmaceuticals. That's because of my bias, because of my experience as an individual in the healthcare system when I was young. So again, I do try to emphasize where my biases lie and also provide as objective information as I can to my clients and patients and, here on my YouTube channel as well, because it's not my job to pick for you. It's your job to collect information and make a decision for you and your family based on the facts that you have been presented with, that you've been open to. So hopefully that makes sense. True informed consent is all your treatment options laid out, the good, the bad, the ugly, right? And sometimes taking an herb has negative side effects. Just because it's natural does not mean it's not toxic. Let's see. What's that anti-cancer drug? Paxil comes from the Pacific U. It's incredibly toxic, very toxic. And we use it for treating certain types of breast cancers. So just because it's natural does not mean it's safer. And just because it's a pill that comes from a fancy pharmacist wearing their white coat behind the counter in a grocery store does not mean it's safer than you going in your backyard and looking at different herbs and understanding how to use them wisely. Yeah. Everything has its place. There is a time and a place for surgery and medication, herbalism, homeopathy, nutrition, all of it. And that's really my dream for healthcare, is that we have a more collaborative approach, team-based, patient-centric, meaning patient walks into my office, they have IBD. Okay, they're on medications. I don't love that. They're having negative side effects, but they're not having any flares. Okay, so then they come to see me as a naturopathic doctor, and we talk about lifestyle, diet, nutrition, hydration, sleep, community, right? We get the counselors involved because having a chronic illness really is a bummer, and it's stressful for your friends and family that may not fully understand. Also, you may feel alone if you're dealing with chronic illness, right? I've been there. It's really confusing when people don't see your sickness, when you're chronically ill and you look healthy, but you don't feel good. Like inside, you don't feel good. And that's where it gets a little bit tricky, right? So collaborative, team-based, patient-focused. And in my ideal world, insurance-free, because insurance has some pros and cons, but it has a lot of cons in my opinion. And actually, my husband just dislocated his shoulder, and I really encouraged him to get an MRI. So we went and did that. The cash pay price for insurance for the MRI was $2,100. The cash pay price for someone without insurance is $850. That's still ridiculous, but let me put it in a little perspective here. If we were paying the $250 a month for him to have health insurance, that's not including deductibles, that's not including co-pays, that's not including time spent waiting to get into the doctor to write a script for the referral for the imaging. That's just the $250 a month payment to have the insurance policy. Okay, so we use his insurance. He's been on that shame insurance since August of 2020, okay? So almost 3 years paying into it, $250. So let's do some quick math. Let's round up to 3, so 36 times 250. I had this pulled up here. 36 times 250, that's $9,000. So $9,000, not including deductibles and copays. We paid $850. Yeah, he lost a couple hours because he had to drive a little bit further away to get the imaging done within the week. We saved a fuckload of money by not having insurance and making sure we are taking very good care of ourselves by eating a nutritious diet, prioritizing sleep and hydration, having community and loving relationships, yada, 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 right? Like all things that, sound great, but are really hard to do for a lot of people. Okay. So collaborative and insurance free, because insurance is a damn scam a lot of the times. Healthcare for all, free from judgment. I am not the practitioner for everybody. I would be the first to admit that. But there is a practitioner for every person out there that needs specific understanding. If you have a history of disordered eating, like there are people that have weight neutral practices. I try to do the very best I can. I've taken additional courses, but I might not be the best fit for you because I am a direct communicator, right? So judgment free. So what about if someone comes to me and they have a traditional cultural practice of some sort of ceremony that I have no idea? It's not part of my ethnicity or my cultural background. Am I going to say, no, you can't do that? No. To me, if that's an important thing to my patient, to my client, to the person that's asking for my support, absolutely. Let's include that in the treatment plan so that your cultural needs, your spiritual needs are being met. There is a lot of goodness and quite a bit of data actually that supports prayer and ceremony as being incredibly beneficial for people dealing with chronic illnesses across the board. Okay, and I talked about informed consent, the good, the bad, the ugly. All right, what's this proton pump inhibitor, propranolol, that they're wanting to get you on, and the box only says to take for 2 weeks, but your doctor's had you on it now for 2 years, you're feeling concerned. Did your doctor ever discuss with you the potential side effects of developing pneumonia, osteoporosis, nutritional deficiencies such as calcium and iron, blah, 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 right? Were those conversations ever had? No, they were not. And is it because the doctor is negligible and wasn't doing his or her job properly? I doubt that. It was more along the lines of like the insurance model and constrained time, etc., etc., etc. And drugs.com is a free resource that has a layperson and a professional tab. It's free. You do yourself a favor and take a peek. And this isn't some fear-mongering thing. This is like iatrogenicity, iatrogenic causes of illness, I suspect are a big part of our chronic illness problem we have here in the US. Iatrogenic is the proper use of medication or surgery that then causes harm or death. And that's a thing, right? I have a gal that I've been working with. She's been taking a proton pump inhibitor for 20 plus years. She has osteoporosis from it. Okay, amongst other multiple nutritional deficiencies, and we've gotten her off of that medication now, right? Like, who is having these conversations about the risks and the benefits? And sometimes the risk of the drug outweighs the benefits. And sometimes the benefits of the drug outweighs the risks. Like sometimes you need to have that thing. And it's person dependent, case dependent, condition dependent. It's never just one size fits all. So if you ever have someone that's saying, hey, you got to take Ozempic, it's the only way for you to lose weight. The only way, always and never, be mindful. Okay. Open-minded with treatments that allow for cultural appropriate needs. And this is what I was insinuating about people that have different ceremonial or spiritual needs. These need to be included and not poo-pooed. There was a case, one of my mentors, Dr. Jared Zeff, talked about at a conference I saw when I was a student of a young boy who was diagnosed with leukemia, lymphoma, I can't remember, and his family was Native. And mom was like, hey, before we get started with chemo and radiation, can I take him and get a couple sweats and some healing ceremonies started? And the oncologist was just like, bloop, freaked out, was not happy, called CPS. This is not the first time I've heard stories about this, of CPS being called because a parent decides that they want to do something slightly different outside of the medical system. And she was on board. She just wanted to do what was appropriate from her cultural perspective first. She didn't say only. And what if she did only want to do it? Your job as a practitioner is to help educate and provide the best information that you possibly can, going back to informed consent, and understanding there are things you don't know, I don't know, our patients don't know. We all come together to work to one goal. So, well-rounded, collaborative. What this means to me is that we're including people in a medical home. I don't want to work in a hospital. That's not my place. I don't want to do surgery. I don't want to do emergency medicine. Although I'm a probably better person if you have no other medical providers to provide you with stitches, I at least have education and training on how to do so and hopefully not leave a scar. And I did pretty good, if I do say so myself. I really enjoyed that. Involving people in a medical home that maybe they are traditional shamans, maybe they are nutritionists, maybe they're health coaches, naturopathic doctors, chiropractors, MDs, DOs. It would be nice if we had DOs that actually did osteopathic techniques in this facility, because the physical medicine aspect is so important and underutilized in medicine. You know, a lot of times people have just like some weird fascial restriction that's causing pain over here, and the problem is here, right? And until we see a body worker, some kind of person that does physical medicine, and no, massage is not the only one. There's osteopathic manipulation, there's chiropractic, there's visceral, there's physical therapists. There's so many different types of body work. Bowen's another one of my personal favorites. When we can come together in unison to work for the better of our patients. Acupuncture, herbalism, counselors, PAs, and nurse practitioners, everybody. In my mind, we all work together because you hire me to help you. You hire your doctors, whether it's through your insurance, in-network shenanigans system or not. In theory, I'm paying $250 a month to have an in-network provider that takes care about me and my needs and my family's needs, right? Right, they work for you. You hire them. You pay them through your insurance company, you hire them. And lastly, the dream of healthcare would not be bought by the FDA. So there are things that are legally I am not allowed to do. For example, recommend, and I would never recommend this, so do not take anything I say as a recommendation. This is for strict educational purposes only. If someone decided they did not want to do chemo and radiation for their cancer treatment, okay? Legally, I am required as a naturopathic doctor registered in Colorado to make them have an oncologist. I am not allowed to work with someone that has a cancer diagnosis without an oncologist. I don't love seeing cancer patients because of this. It's just, cancer is its own beast. Give me the kids, give me the gut stuff, the hormone issues, much more enjoyable for me than the nuance that comes with cancer therapy, especially when you have chemo and radiation on board. It's just, that's not where my passions lie. And I have a good referral network if you want, but there is a gal named Nasha Winters who is a naturopathic doctor that practices down in Mexico, so she doesn't have to deal with the FDA shenanigans. And my understanding is she gets pretty dang good results. So if we allow there to be place for people over profits, and again, not anti-capitalist, I just understand that the system that has bought the industry, bought the FDA, comes from buku bucks, big money. Okay, I'm talking big industry, big pharma, absolutely. And there's a couple of books I would highly recommend if you have not read and are interested in this. The Truth About Drug Companies by Marcia A. She's a medical doctor that previously was the editor of the Journal of American Medical Association. That came out in the early 2000s. I just read it. If you get huffy about this type of stuff, do not read it before bed because you will not be able to sleep. She writes from a little bit more of I wouldn't say defensive posture, but a little bit more antagonistic posture compared to John Abramson's, who's also a medical doctor, family practice, small town, The Sickening that was just published in February of 2022. Great book, really practical application. If you are in healthcare and you have not read one or both of these books, you need to add them to your reading list and put them close to the top because they will help you understand the marketing baloney and propaganda garbage that we as practitioners are being inundated with, but we also as consumers that are being inundated with. And as much as I love the freedom of speech that the good old US of A has, that's why Big Pharma can advertise to us on TV. We are one of 2 countries that is allowed to do that, New Zealand being the other. However, there's far stricter regulations. We've all seen those drug commercials where migraines, and they're frolicking through a field, and you just want to be able to go do that, and it looks great, and then side effects may include and death, right? We've all seen those commercials, and it's really enticing, especially if we've been hypnotized by the TV because we're watching it over and over and over and over and over, right? Fear and mongering and conditioning that comes with doing the same thing over and over really does hypnotize us. So FDA has been captured by industry, and I would like to see that change. The FDA is not for us. It's not for the safety of us. It's for profits, unfortunately. The biggest, we all think incorrectly that it's a nonprofit, and even if it is a nonprofit, it's still privately funded by big bucks. And I don't know about you, but I don't have those big bucks that I'm funding them with. So my sway as a little old naturopathic doctor is very minimal. All I can do is continue to educate people about the potential negative effects of their medications that could be causing their psychosis that they think is, the only thing that's saving them from the brinking edge. But we just are not educated enough to understand the complexity that then comes with these single mechanism drugs that do one thing, whack-a-mole, whacks the symptom down, but then you have a different symptom that pops up. Let's get into a brief history of modern healthcare. So I am talking about the pills, the surgery, how all medical schools, at least in the US and Canada, I'm not sure about the UK and other parts of the country, because when I've worked with other medical providers that have degrees from other continents outside of North America, they're a lot more open to herbs and body work and more of these traditional medicines than we are here in the US. We have a ton of skepticism around herbs, and I get all the time, is this safe? Is this safe? Is this safe? Is this safe to take with my medication? Is this safe for my kid to take? Is this safe for me to take? And is it going to cause side effects? Like, we've got so much misinformation and confusion around herbal medicine. And again, natural doesn't mean safer than synthetic medications derived from petroleum byproducts. It just means that there are a lot of really safe herbs that are probably in your backyard that you've been told are weeds that you should spray Roundup and other pesticides and herbicides on, right? Okay, so let's get into this a little bit. I want to go through a couple definitions. Traditional medicine is not pills and surgery. No. Traditional medicine has been around for eons, okay? This is the people of the land, the people's medicines. Homeopathy is even relatively new compared to herbalism and ceremony and community and diet and really focusing on these types of things, and earthen therapies where you actually like use mud and water to treat illness and injuries. It's really fascinating. If you wanted to dig into that, I just want you to have that understanding that traditional medicine dates back way before the 1850s, when modern medicine started to make its, headway in the North American medical system. Conventional medicine, aka allopathic medicine. This is study of pathology, study of the disease state, okay? This is conventional modern medicine, pills and surgery. You don't get talked about, you can do quercetin when you have allergies, you just take Claritin. There's no conversation around reducing inflammatory foods when you have really severe allergies or on autoimmune flare, as one of my patients astutely shared. Well, no one told me my diet could have anything to do with, or the fact that I'm drinking. She was drinking pretty much every day, a couple drinks, not a lot, but a couple drinks. She had an autoimmune disease. None of the 4 rheumatologists that she saw mentioned that alcohol can be pretty inflammatory. Maybe, cut that down. And I'm not an all or nothing person. We cut it down to 2 times a week. And she was able to come off her medications on her own accord because she wanted to get pregnant. And I love that for her. I love that she felt like she had the skill and the knowledge and the wherewithal and confidence in herself. And I'm not saying to do that, so please do not take this out of context. It is always dependent. And I really do encourage people to work with their prescribing practitioner to come off of their medications, okay? Please work with a prescribing healthcare practitioner. There are some medications you cannot just stop. Psychiatric medications being a very large class of those, and beta blockers, another one that we often use for regulating the heart rate, okay? Let's kind of get into this a little bit more now that we have some of those definitions. Regular and irregular. Another definition I want to talk about. Medical doctors, conventional practitioners are regulars. I've often been asked by colleagues, why do I use that term to describe MDs? I feel like it's a little less what's the word I'm looking for? Condensating? Not condensating. Condescending. Condescending to call them regulars than it does to call them conventional or allopathic. Like, that can be a little bit flippant. It's not, it's just simply understanding root words in my mind, but whatever. The regulars, and then the irregulars would be herbalists, body workers, homeopaths, naturopathic doctors, chiropractors. These are people that are alternative, that we have been labeled alternative practitioners in this modern medicine realm. We are not alternative. We are in addition to, not separate, not only. Although some people, have gotten so freaked out by the conventional medical paradigm that they have gone to the extreme end and won't do. I had someone that really needed to see a neurologist when I first started practicing, and he hadn't seen a doctor in over 10 years, and he really needed to see a neurologist. And he felt more confident with someone like me who bridges the gap between alternative, quote unquote, medicine and modern medicine. He now knew that I wasn't just going to pull his leg. Like, if we could have done something nutritionally or herbally, I would have been a lot more, pushing of that, right? But he really needed to get in to make sure he didn't have a brain tumor. All right, so let's start from the beginning. And like I said, this is going to upset some people, and I don't care. Open up a book. I was annoyed with history when I found this out too. And unfortunately, we get marketed and propagandized, if that's even a word, all the time. Just got back from a weekend survival course put on by Jessie Krebs. I want to call her like Krebs Cycle or something because there's just like some nerd jokes there. Anyway, she went to SEER training when she was in the military, and so she was teaching a survival course. Really impressive lady, lots of really good skills, but she debunked so many things that the outdoor industry would have us believe that we need. For example, whistles. Unless a person's really close to you, they're not going to hear any damn whistle. Maybe if you're in a canyon, they might hear the echo or reverb. But like, there's so much crap that we are marketed at with that we just don't need. It's not worth it. It's gimmicky garbage. And I would say in healthcare, unfortunately, there's a lot of this gimmicky garbage that we just don't freaking need. Hence the number one spender in healthcare in the freaking world. And our healthcare outcomes are garbage. You know, with 1 in 32 kids now being diagnosed with ASD, that was the stat that came out July of last year, 2022. That's not okay. And no, it's not simply just because we've gotten better at diagnosing. Yes, that may be playing a role, but there's something else a little more unpleasant, I think, going on there. As I alluded to, prescription medications, 99% of them are derived from petroleum byproducts. Petroleum as in the oil industry. So we often will say, and again, take what I'm saying with consideration to you, the individual, in your own healthcare. That's the last time I'm going to say that. So please hear me. When you give yourself oil, so just think about taking like a little oil tab, and this is synthetically derived substances that are chemical structures of whatever. Okay, let's take aspirin. Aspirin is a great one because it actually was originally derived from salicylate. I'm having a hard time with words today. Salicylic acid, which comes from plants. So like willow, for example. And it's in poplar buds or cottonwood buds as well. Like there's a few different things where natural aspirin can be found as a pain reliever. So it's synthetically derived to look like aspirin or salicylic acid. And we use that. And people have aspirin allergies. So it's cheaper, though, if we can use it from a petroleum byproduct as opposed to going out and like harvesting from the willow. And anybody that's ever harvested willow knows it's time consuming, it's worth it, and you'll make some delicious herbal goodies, but it does take time. Time that an industry that's very profit driven, and I'm not saying there's anything wrong with that, but like a little balance could be good. Don't have. Like, we want profits, we want them now for the least cost we can put into making and manufacturing this product and getting it out into the market. Pharmaceuticals are petroleum-based products. So this is interesting in my mind. Names like Carnegie and Rockefeller, and then of course Vanderbilt and Morgan, JP Morgan, the banks, the trains, the tobacco industry, and the oil industry. Rockefeller's oil, Carnegie's the tobacco industry, which tobacco industry brought a lot of the super processed, ultra processed food that's chemically engineered to be more palatable and increase your desire to like keep eating after you're satiated. It like overrides your satiation signals. So much like smoking cigarettes does, if you've ever had the privilege of attempting to quit, you know, can be quite difficult. So Rockefeller wanted a way to use his money to help with healthcare. And whether or not I'm going to get this story exactly right, you know, just take my words with a grain of salt. But the general gist is Rockefeller funded a nonprofit. And he funded the nonprofit of the WHO, the World Health Organization. It's a really wonderful organization, right? Saves lots of lives. Actually, the World Health Organization has the best definition of health. WHO defines health because it is inclusive. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmary. That's the WHO's definition of health. Yes, it's not the mere absence of disease. If we put health on a scale of 1 to 10, 10 being the best health ever, and 1 being the crappiest health you'll ever have, you're on death's door. 5 is asymptomatic. You have no symptoms. You feel okay. You don't feel great. Your body works well enough, right? You don't really know any different. Oh, you know, you got a cold, you don't feel great. It takes you 2-3 weeks to get over it. Great. Oh, now you start drinking enough water and you're a little bit less grumpy, a little less anxious. You're sleeping better. Your cognitive ability has increased. Okay, so maybe you go from a 5 to a 6 now. All right, let's get you eating a well-balanced meal with a balance of macros, protein, carbs, and fats. Really prioritizing protein and fiber. So vegetables, protein and vegetables. Now you're starting to feel a little bit better, and you're noticing that you're having good poops, and again, energy's improving. Like you went from maybe a 5 or 6 on an energy scale, and you're getting out of bed, and you don't need that cup of coffee that you once relied so heavily on, right? Our health, you're never going to get there. It's not like you have one great night of sleep and like all of the world's problems are resolved. Although that day you feel great. The next night, if you don't prioritize sleep, you're a little bit slower, a little bit less functional than you would have been had you prioritized sleep. Right? Back to Rockefeller, funding nonprofit organizations so he could make some more money and oil and the oil and healthcare. Super awesome. Petroleum is definitely going to make all of my dreams and desires for my health to improve dramatically. Okay, so the Flexner Report of 1910. No conversation about modern medicine would be complete without this report. The Flexner Report was written by Abraham Flexner, who was funded by Rockefeller. And what this law basically did, this report, it had the regulars, the conventional medical practitioners, be in control of regulations and the medical orthodoxy. So poo-pooing things like herbalism and homeopathy and hydrotherapy because, you can't make money off of people that are getting well and improving their health. So if we control the narrative, the story that's being told to the public, we're going to be able to make more money. And again, I'm not saying that doctors are trying to kill us. What I am saying is that there is a system that was set into motion before I was born, before my mom was born, and before my grandma was born, and before my great-grandma was born. Like, this doesn't start in 1910. This actually starts in the 1850s, late 1840s, where the American Medical Association was founded. And their two purposes, the American Medical Association, was to improve the social standings of their doctors, and their status, if you will, and to improve their income. So how do we do this? If we limit the people that can come into schools, if we limit the number of schools, so we're really making this a higher class, and traditionally medical practitioners were from very wealthy classes. They had a lot of money, a lot of social standing, right? And that's part of the goal, okay? This was a good one. Okay, so we've all heard this word. Oh, you're just a quack. I get called that all the time, so much so that I now make jokes about it, and I call myself a duck, and if a duck quacks, then it must be a quack, right? I can make a little humor out of that because it doesn't really bother me, but the defining moment for quackery, that term, came about in 1868. So just 20 years after the AMA was founded, they made a definition about what quackery is and who practiced quackery. So again, that's controlling the medical orthodoxy, the medical narrative, who is a good doctor and who is not a good doctor. Now, fortunately, there was some good things that came out of the Flexner Report, in my opinion, which was holding all medical schools to the same level of basic sciences. We all have to have a base foundation. Much like my conventional regular counterparts, I learn embryology and biochemistry and histology and pathology, even though I don't identify as a allopathic practitioner. I still have to understand the thinking that comes there because I have a patient now that I have to unwind their learning to teach them how to become their own best healer. And that does require unpacking and unwinding this somewhat of a nightmare that we've gotten ourselves into with health. Okay, so these two ideologies, the allopathic and the more hygienic preventative, this dates back to Hippocrates' time in the early, 800 BCE. Fact check me on dates. I'm not one for memorizing dates. Like I said, that's what makes history boring and dumb. So there's two gods, a god and a goddess actually. Asclepius, there's actually plants that are named the genus is Asclepius, which is really fun. Asclepius practitioners are regulars. They are very much the treating the sickness, pills and surgery, burn, poison, and destroy. Burn, burn, poison, and cut processes of healing. And again, there's a time and place for that, but I think that's more wartime medicine rather than it is actually super beneficial for the average strep throat or the average hand, foot, and mouth, or the average skin tag, or type 2 diabetes, or other types of cardiovascular disease, or mental emotional health. What, you're just gonna do a lobotomy? We learned the hard way there. That does not work. So kind of think about regulars and Asclepian medicine being much like conventional agricultural. Let's till the soil, destroy all the weeds, all of the micro organisms that live in that soil, till it up, till it up, till it up. And then after we plant our seeds, that's why you have Roundup Ready seeds for your corn. You're gonna plant your corn and you're gonna spray that soil down with Roundup. Spray it down, poison it. So we've cut and we've poisoned the soil. And again, maybe there's nothing wrong with that. I tend to shy away from those things. I don't feel like those are the most beneficial. They are destroying the earth. And we are, in my mind, stewards. Humans are meant to be stewards of the earth, not just simply destroyers. And then there's Hygeia. Hygeia is actually the daughter of Asclepius in mythology. And she brings to us hygiene. Remember I talked about mud and water as therapeutic for injuries? This is old medicine. You know, we will see animals in the wild that get injured and they will go to the river every day, multiple times a day, to nurse that wound until they are well. They don't, a wild boar in Africa or in Texas isn't going to head over to the vet office and, go through their insurance and get a ACL repair. Like if they've been injured, no, they're going to find another way to modify it. Is it going to be great or as perfect as an ACL repair? Maybe not. I can't say. I'm not that pig. And I've not had the opportunity to have ACL surgery, and knock on fake wood, hopefully I won't. Hygeia, or the medicine that I practice, is health promoting. We understand how health happens. We understand from a normal physiology what happens when we have disease. And the disease doesn't really matter at the end of the day. It's more along the lines of the body wants to be well. Why isn't it? Okay, does it have all the tools it needs to be well? Okay, you're not drinking enough water. And I keep pounding this one because it's one of the most important foundations for health. And it's also, so many people are not drinking enough water, or they're over drinking water, or they're not putting minerals in their water, or they're drinking tap water. Whatever the case may be, there's like multiple layers to it. So, and I like to compare this to regenerative agriculture. These people are understanding the physiology of the soil, our bodies being very much like the soil. If we understand how the soil, the organism works, it'll be way easier to help backstep a person from a dis-ease state back in towards health. So you go from like having IBD flares and you're pooping your pants and you've had a colostomy bag and you've had multiple surgeries and you've lost a lot of weight and you can't do the activities that you've once done and you're on multiple medications, yes, and let's start backstepping. Let's start pulling those strands so we can get you a little bit feeling better. So we go from a 2 on health to now maybe you're drinking enough water and you're maintaining and you're absorbing your nutrients that you're starting to gain a little bit weight back again, right? Like it's never like 0 to 60. Although I do love when I get those cases where it's like a week later, they're so much better. Exception, not the usual. Okay. So those are the two schools of thought. And we all take the Hippocratic Oath. We have a slightly different variation, but the premise of it is we need to do the best we can and care for our patients without doing harm to them. And if we don't have proper informed consent around medications, around surgeries, around the fact that sham surgery for ACL repair is more effective than actually ACL repair in this surgery, and I don't remember the N number of participants in this, but we got to be harnessing these things. The problem is the placebo effect doesn't make money. And it's crappy to come to these realizations that if we're not making money, industry dies. And I don't know that I'd be too upset if Big Pharma was a little bit more of a reasonably sized industry. That was one of the things, the big takeaways I had with The Truth About Drug Companies, written by that MD that was the former editor of the Journal of American Medicine. So that's in 1910. And in 1850, the AMA was started, and they started slandering us with words like quackery, and they were trying to dismiss us irregular practitioners, dismiss us, make us sound like we're just crazy nut jobs, disregard us, discard us. You don't need that. Herbalism is dangerous. Don't have chamomile tea. You're going to kill your kids. Unless you have a severe allergy, like you actually have a true allergy to chamomile, chamomile is very safe. It's actually, to use the marketing jargon that the pharmaceutical industry uses, safe and effective. Safe and effective for helping digestive concerns, reducing ill effects of indigestion. It's calming, so it helps to soothe the nervous system. And it tastes great. Like, who doesn't love a good cup of chamomile tea? I have yet to meet someone that's like chamomile. Blech. And if you're there, I'm sure you're out there. I'm sure you are. It's too bad for you, more for me. All right. So going back to that Flexner report, one of the things I had told you was the benefit was that all medical education had a base foundation now. Whether it was the homeopathic medical schools, which Samuel Hahnemann is the founder or discoverer, we'll call him the discoverer of homeopathy in the late 1700s, so older than modern medicine, but still not as old as ceremony and community and food. Like, that's been around since humans begun. Existing and thriving on this planet, and the various flavors that humans have existed. We got the Rockefeller Foundation, the AMA, and the FDA. And I should have taken notes on when the FDA was founded. When was it? Let's check this. When was the FDA founded? When was the FDA? In 1906, so just before the Flexner Report. Perfect. So that kind of makes sense. So you've got the Rockefeller Foundation funded by big oil money. You've got the AMA that was started by Rockefeller, and the FDA that was started right around this time. And anybody that knows anything about American politics knows that it's a rotating door between these different regulatory agencies. You could have someone that was consulting for Merck, a pharmaceutical company here in the US, and they then become the head of the FDA. You think they're in pocket with Merck? Probably not supposed to be, but keep quiet. We'll see heads of the USDA who previously worked for Monsanto, which has been bought as of 2018 by Bayer Pharmaceuticals, one of the main funders for Nazi Germany, by the way, one of 3 pharmaceutical companies that funded all those atrocious experiments that we did on other humans, other human beings. We did learn a lot, but it's really messed up what we freaking did to each other. These are our human beings, our brothers and sisters. The thing, only American Medical Association docs are scientific. And we've all heard this. If you're not scientific, you're a quack. Show me the science. Where's the data? Where's the PubMed study? The truth about drug companies and The Sickening, both written by medical doctors, MDs, that went to medical school, not some crazy, quack naturopathic doctor over here. They have seen the system really suffer. And these grassroots organizations that people love to donate to are oftentimes a front. And pharmaceutical companies write their studies and they omit information. They don't give the scientists that are reviewing the information to write the publishable study all of the raw data so they can come to a actual accurate scientific conclusion. When you omit certain information, like for example with Vioxx, which is a COX-2 inhibitor, and it's an anti-inflammatory medication. Like, I remember my mom was on Celebrex when I was growing up. It's in that same family, although Celebrex was brought back on the market, and my understanding is Vioxx never came back. The big problem here, and I'd say this is the most famous of the pharmaceutical mishaps in the last 20 years, was heart attack and stroke. And I'm not talking about in like grandpa and grandma, I'm talking about in young people, 30s, 40s, 50s, having stroke and heart attack suddenly out of nowhere. The whole claim was that it was less irritating than taking like ibuprofen would have been, or naproxen. And it was blatantly false. It was false advertising. It was propagandized garbage to sell money and make a profit. And they still made profit even though they had to pay money and take it off the market. They omitted the information from the original studies to make it seem like it was far more effective and safer, safe and effective. We've all heard that, safe and effective, safe and effective, safe and effective. Than, its over-the-counter counterparts. Same, and it's not. It wasn't. It killed people. It killed tens of thousands of people, in fact, before it was pulled from the market, which is really messed up if you ask me. But your insurance paid for it, so who cares, right? It's free. It's not free. You paid however much money you pay a month for your insurance carrier to then sell you medications that are killing you, potentially killing you. Let's say that. All right, so if you are not an association, American Medical Association doctor, you are a quack and you are unscientific. So we are dismissing, disregarding, and discarding anybody else that's outside of this system, right? That doesn't work for me. My health did not do well. My health did not do well with that. So let's see. Oh God. Okay, so we're kind of bouncing around here. In the late 1800s, there was a man named G.H. Simons. He created a propaganda department under the American Medical Association to smear my profession, the irregulars, the homeopaths, the herbalists, the shamans, the traditional healers of all flavors, counselors too. Counselors only became like regular members of the community within the last 30 years. Maybe in the 70s, they started to become a little more acceptable. So like the 50 years ago. And the propaganda department, propaganda, what is that? Safe and effective. It's super safe and effective. People frolicking through fields. That's really safe and effective, right? I want to frolic through a field. I sure do. Sounds like fun, okay? And if you remember, if you're old enough, and I've seen these ads because I've, in the medical industry, doctors recommend Camel brand cigarettes. Remember I told you? Carnegie, the big tobacco owner, was in bed with Rockefeller. Let's bind together and let's make tons of money at the expense of everybody. Who cares? Who cares what the cost is? And I do believe you can make money and not kill people or kill less people, like going back to that ethical dilemma, right? All right, so we have things like food products such as soda that support this cigarette shenanigans. Remember, I told you big tobacco and big food were purchased by the same person, Carnegie. So Carnegie and Rockefeller are best buds here because they're making people sick, telling them that drinking soda with cocaine in it is great for you. Smoke your cigarette, it's non-addictive. Doctors recommend Camels. And all of your medications you're taking are safe and effective. Meanwhile, these are the same people that were prescribing excessive amounts of bloodletting, excessive being the key word there, and mercury to treat things. Mercury and arsenic, I'm sorry. There is no safe form of mercury. Not the crap that's in your teeth, not in water, not in fish. That's why the EPA has regulations on the amount of certain large predator fish that you should or should not be eating, okay? All right. So, and I don't have the date on this. So there was a guy named Fishbein, who was the predecessor to the guy that created the propaganda department. And there was a man in Texas. If you've ever heard of the Hoxsey formula, it's an herbal formula that helped cure cancer. And you can't say that. I've never used the Hoxsey formula. I don't work with people that have cancer. Not my thing. But this is part of history. His father died. He was an oilman's son from Texas. He had money. He went head-to-head with the AMA, and he actually won the lawsuit. But unfortunately, by the time 1960 rolled around, all the Hoxsey clinics that were seeing people dealing with cancers had closed for a variety of reasons, likely due to the propaganda and marketing shenanigans that we all are so familiar. So iatrogenicity, I mentioned earlier, is the proper use of medications. It causes illness and death. If we actually take the data and we include it in the leading causes of death in the United States, conservative estimates suggest it's number 3, ahead of cardiovascular disease in this country. So here, let me look here. Top killers in the USA. Heart disease, cancer. Oh, that's so dumb. It is far worse than COVID. So the CDC, another captured industry, heart disease, cancer, and then COVID is there. And I would actually put that down and put iatrogenicity and then COVID. Iatrogenicity is a major problem, and some statisticians think that it's number 1 killer above cardiovascular disease, which is sitting at almost 700,000 people a year dying from things that are preventable. I don't care if your mom and your grandma also had cardiovascular disease. Both of my parents died from heart issues, okay? I'm not about to be doing that. Like, I'm taking better care of myself knowing that those are risk factors. And you know what we also share? We also share our stressors, our diet, our other lifestyle components, our environmental toxin exposures, etc. So is it strictly genetics? Probably not. Probably not, which is very empowering and also super overwhelming for a lot of people, I'm aware. Pharmaceutical research. They spend for every dollar they spend $19 on marketing. For $1 on research, they spend $19 on marketing. That's a 1-to-20 ratio. We'll round up. I like even numbers. It's a little bit easier in my brain to conceptualize. 24 million spent on marketing to doctors themselves. So in my profession, we can't get continuing medical education if a supplement company, sponsors the lunch. If a supplement company, if a specific supplement is talked about, say someone's treating eczema and they're using this specific test and this specific set of supplements, nutrition, and herbal formulas, and we won't get CE if they are mentioned. Continuing education CE. What about pharmaceutical sponsored hospitals? And we've all seen Coke and Pepsi and all the ultra processed food. And I'm an 80-20 gal. Like, there's a time and a place for some pretzels and gummy bears, but not in a hospital. I mean, maybe. I mean, there's always an exception. That's not health promoting. I'm sorry. Soda is not health promoting. A bunch of refined grains covered in seed oils is not health promoting. It should not be the main thing you find at a hospital. Okay? 66% of pharmaceuticals produced in the world. We've got almost 8 billion people, right? In the world. There's 330 million people in the US. We are 3 billion people less in the United States than India and China. And we consume 2/3 of the manufactured pharmaceuticals. Are we really that sick? Or are drugs making us that sick? That's what I've been alluding to with this iatrogenicity talk. Are the medications you're taking actually causing chronic illnesses that you're then going to see a different specialist for? They're not communicating. Remember, collaborative is part of my dream. And then you get diagnosed with stomach ulcers, which are associated with taking corticosteroids and the other anti-asthma medications that you've been on, right? Like, it just becomes this whole thing. And then eventually 1 in 2 men will get cancer, and 1 in 3 women in the United States will get a cancer diagnosis at some point in their lifetime. I would be really curious what those numbers are on people that have stepped outside of the healthcare system or people that have their own communities, like the Mennonites or the Amish, and what their rates of cardiovascular disease and cancer are compared to the average American that trusts the medical industrial complex like it's the thing that's keeping them alive. Talked about those, and let me drop one more date, okay? In 1987, the Vaccine Liability Act was passed. Vaccines are life-saving medications. There is no longer any liability for pharmaceutical companies that create and manufacture these vaccines. They are still pharmaceutical. They get a special place in our heart because, polio, right? I would encourage you to look at some history and see if you come to the same conclusion that our wonderful public health has come to conclude about polio. We'll save that for another conversation. And they are not liable. So if you get injured, or if you get injured like my family member did, my brother, it changed our entire family because he was damaged. And I know people that were damaged far worse than he was, really severe, or died. And that doesn't happen to most people, but it does happen. That's the important thing here, is informed consent requires the good, the bad, and the ugly. These are still petroleum-based products. They still have adjuvants in them that are toxic. Aluminum that doesn't pass through the liver, our natural detoxification center. You're going to really sit there and tell me that the amount of aluminum that's in the hepatitis B vaccine we give to a day-old baby is okay? Are the parents drug addicts, IV drug users, and prostitutes? Hepatitis B isn't endemic in the United States. Anyway, I digress. Just like I implore you to do a little bit of personal digging and understanding of the history of medicine. And I'm not anti. Those are also dismissive and derogatory and denigrating words, part of the propaganda machine to make it seem like those of us that question are quacks, quack, quack. Remember, if it quacks like a duck, it must be a quack. I will continue to wear this hat because of the things I have seen, the things I have experienced, both professionally and personally. It matters to me that we understand history. And this is coming from someone who doesn't love history. I understand now the importance of knowing history and where we come from. Okay? All right, what about kind of a slight tangent, and then we're going to wrap up here. Evidence-based medicine, or evidence-informed medicine. You want to be fancy about it. There are 3 legs to this stool of evidence-based medicine. There are research, You got those hard facts from the PubMed studies, which about 50% of them, again, read the books. You'll learn a lot. It's really interesting. So research. All right. And let's just assume that it's good research, high quality, doesn't have bias. All the boxes are checked. It's a great study. Awesome. Clinical expertise also plays a role. Sometimes things that show up in research in a very controlled environment just don't pan out clinically. It just doesn't happen. Okay? I can't think of a great example of that right now, but we are dynamic creatures and you don't live in a lab. You're not a rat. You're maybe choosing to do things like drink alcohol and stay up late, and you took this medication and you had a negative side effect from it because you were drinking too much and you stayed up late. Like that could be. Like whatever. And then patient preference. So you sit in my office and you say, man, I don't really want to take a medication. If I really have to, I will, but I'd really rather try to do it through lifestyle modification and, naturally if possible. Okay, great. Informed consent comes in here. All right, so you come to see me and you've got type 2 diabetes and your blood sugars don't look terrible, but you really don't want to go on the medications. So let's talk about nutrition and hydration and good sleep and stress management. And maybe we're going to get you on some berberine, which has really good comparative data compared to metformin, head to head. Again, they're trying to move away from metformin because it's cheap, not profit oriented. They lost its patent. They lost the patent. The pharmaceutical industry did. Whoever owns that drug, metformin. So really, evidence-based medicine should be patient-centric. Now, let me give you another example. You get in an awful car accident. You're unconscious. You have multiple broken bones. You have a severe hemorrhage. You have ruptured organs. Your preference don't fucking matter. Unless you have an advanced directive, you're going to get life-saving therapy, treatment that's going to save your life, and your family and your friends are going to be so grateful that you lived. Me too. If that happens, modern medicine is amazing at wartime life-saving supports. And I am grateful, so grateful, so grateful. Like, do not take this video as a thing of me being upset and negative against. Collaborative. We are collaborative. I work with, not against. It's about the best outcome for my patient. I just had a patient that was having a really elevated heart rate. They're having a hyperthyroid issue, high thyroid issue. They're running on high, some voice changes and some really high heart rate. It was really distressing to the patient. I said, look, I'm going away for a trip. Let's have plan one. Let's get you taking some Nervine, some strong Nervine herbs. It's been effective for me in the past, helping people with reducing their heart rate. I get a message from her. It worked, but we had made a backup plan. Hey, reach out to your primary care doc that can write a script for you. I'd want you to get started on a beta blocker. These are the 2 beta blockers I'd prefer over any of the other ones. Great. We have a backup plan. It's not either or. She didn't want that, but she was open to it. So I paid attention to patient preference and also what's within my scope, but I also gave her a plan. If shit does hit the fan, this is where you're going to go. This is what you need to do. She has a plan. We have all of our bases covered. In summary, real healthcare requires an open mind that many types of modalities are effective and useful at treating and even curing, sorry FDA, sorry Big Pharma, by working together as we once have, the regulars and irregulars alike, we come together for better patient outcomes and improved quality of life. That's what my dream is for us to come together and not be so divided. There's a time and a place for pills, not the way that 66% of pharmaceuticals being consumed in the United States are. So thank you for listening, and I'd love to hear any questions that you guys may have about this. And if I'm wrong, what's up? I'm open to being wrong, and let me know, and I will correct my mistake publicly.